The Dobutamine stress echocardiogram, or DSE, is a crucial diagnostic tool in the management of aortic stenosis, a condition characterized by the narrowing of the aortic valve. DSE is particularly valuable for assessing the severity of the condition, guiding treatment decisions, and evaluating patient prognosis. In patients with low flow, low gradient aortic stenosis, those with a low ejection fraction and low aortic valve gradient, DSE is used to distinguish between true severe aortic stenosis and pseudo-severe aortic stenosis. This distinction is vital because true severe AS requires aortic valve replacement, whereas pseudo-severe AS may be managed differently. DSE helps determine whether the stenosis is truly severe by increasing the heart's contractility and observing how the valve area and gradient respond. Sometimes, the findings from standard echocardiography can be ambiguous. In these cases, DSE can help differentiate between true severe aortic stenosis, where the valve area does not increase significantly with stress, and pseudo-severe aortic stenosis, where the valve area increases with stress due to improved cardiac output. This distinction is crucial for deciding whether a patient should undergo aortic valve replacement or continue with medical management. In patients with low flow, low gradient aortic stenosis, and reduced left ventricular ejection fraction, DSE is used to assess contractile reserve, the heart's ability to increase its output in response to stress. The presence of contractile reserve is a positive prognostic indicator, suggesting that the patient may benefit from aortic valve replacement. Conversely, the absence of contractile reserve indicates a higher surgical risk and may influence the decision-making process regarding surgery. DSE is also valuable for preoperative risk stratification in patients with aortic stenosis who are being considered for non-cardiac surgery. By evaluating the heart's hemodynamic response to stress, DSE helps assess the risk of perioperative cardiac complications and guides the timing of aortic valve intervention relative to non-cardiac surgery. When non-invasive tests, such as transthoracic echocardiography, provide inconclusive or borderline results regarding the severity of aortic stenosis, DSE can be used to provide additional hemodynamic data. This helps confirm whether the stenosis is moderate or severe, which is critical for making informed treatment decisions, especially in symptomatic patients. In patients with severe aortic stenosis who are asymptomatic, DSE can help assess the risk of future adverse events by evaluating the heart's response to stress. Identifying abnormal responses or a lack of contractile reserve during DSE in asymptomatic patients may suggest a higher risk of disease progression and could influence the timing of aortic valve replacement, even in the absence of symptoms. DSE is also used to measure changes in the aortic valve area, or AVA, and the mean pressure gradient across the valve during stress. These measurements are essential for assessing the functional severity of aortic stenosis and determining the need for surgical intervention. In patients with a bicuspid aortic valve, particularly those with unclear severity of stenosis or reduced left ventricular function, DSE can help determine the functional impact of the valve stenosis. The test provides insights into the progression of aortic stenosis and helps guide the timing of surgical intervention. Finally, DSE is used to evaluate left ventricular function in patients with aortic stenosis, particularly in those with reduced ejection fraction. This assessment is crucial for determining the heart's ability to respond to stress, which influences the overall prognosis and helps decide on the best treatment strategy. In summary, the Dobutamine stress echocardiogram is a versatile and valuable tool in the management of aortic stenosis. It provides critical information on the severity of the disease, the functional status of the aortic valve, and the heart's ability to respond to stress. These insights are essential for making informed decisions about treatment, including the timing of aortic valve replacement and other interventions.